So my name is Dr. Gilford Mwikamba. I am a consultant physician and diabetologist, currently working at Consolata Hospital Nkobo in Meru. I'm a beneficiary of the Merck Foundation program, where I undertook a postgraduate diploma in diabetes under the Merck Foundation Diabetes Blueprint program. I completed in September 2021, and subsequently I've been practicing diabetes care in this region. In this region, I'm actually the only diabetologist available in serving approximately 3 counties. And I would want to say that from the time I enrolled in this program, I actually feel that I've been very enabled capacity-wise. One of the major areas that we are impacting was mainly, first of all, improvement in diagnosis of diabetes, particularly in this region where we are under big challenge in diagnosis of diabetes in pregnancy and the various spectrum of disease in that condition. In this institution in particular, we are able to upgrade our laboratory to be able to do, including OGTT, which really enhanced our capacity to diagnose and manage diabetes in pregnancy. This region, as maybe probably most people are aware, has a very high prevalence of diabetes. It's one of those areas that has a very heavy burden of non-communicable diseases. And because of that, we've been able to dedicate a specialized diabetic clinic that is run by myself in conjunction with another medical officer whom I'm mentoring to also be able to manage diabetes properly. So I'd say from the time I enrolled in this program, I've really benefited in terms of even transfer of the skills that I acquired. I've been able to train a medical officer under my care, and I've been able to do a number of CMEs within the hospital and even within the region. The last one actually being approximately 2 weeks ago, where we looked at cardiometabolic care in type 2 diabetes. And from that time, actually, I've been getting quite a number of referrals, particularly people concerned with risk modification in diabetes and even risk factor control in diabetes. I must say that that has been quite impactful. The other major impact that this course had to me as a person is prior to enrolling this course, I decided not to take any further training. I felt probably after achieving my master's and done enough, and therefore I decided not to engage more academically. But after actually getting this course, I realized there's actually a lot to be done, and subsequently I've actually been upgrading my skills and knowledge in this subject. In my opinion, I felt that first of all, the course was extremely relevant. It was extremely relevant to my region. The content was adequate and well measured. The delivery was particularly excellent because it was sequential in the sense that every concept was delivered sequentially, and the interaction with the tutors was perfect. They were always available to respond to most of our questions. Honestly speaking, I don't have any way I can fault the delivery of this course. I felt like, in fact, we actually learned, as a person, I learned that it is possible to transfer most of these things electronically or even online without necessarily having physical contact. I, however, felt that probably in the course, as part of improvement of the course, it would be of value to probably organize some brief, elective program where the trainees maybe travel for a brief attachment, even if it is 1 month in a busy program, particularly in programs that are involved in the care of obesity. I felt that somebody being on the ground may have really reinforced the understanding of the subject. But overall, I would actually say that the course was excellent. I would really highly recommend this course to most of my colleagues. And that is because, number one, it is very relevant for our region. We have a very high prevalence of this condition that we are managing. A majority of those patients around here are getting suboptimal care, mainly because of lack of access of specialists. I would first of all want to say that, first of all, as a person, I would really want to acknowledge and appreciate the sponsorship from the Merck Foundation. I would also want to really appreciate the fact that they made me change my mind in terms of pursuing further training. Indeed, I've actually moved from diabetes and even gone to endocrinology, a course that I want to pursue up to the level of MSc. And I really want to thank them so much for opening up this course, because one of the major problems in our country has been opportunities for training. And by offering this large-scale opportunity to most of us, then it has really transitioned to improvement in care of our patients. So I really want to thank them so much.